the number of newly confirmed cases were quite stable for about 2 months, but since the beginning of April, we see a rapid increase of confirmed cases. How do you analyze the situation in Japan and perhaps other countries in Asia while the center of the pandemic is still in Europe? Thank you.
Yeah, I think Japan, in fact, we had some very excellent data from Japan on their approach over the last number of months, and Japan has done a very, very good job over months, and it's taken an approach of very systematic investigation of clusters. In fact, I think they call many of their teams the cluster busters. They have these very specialized teams that have been going out and investigating clusters. And not only have they been able to contain those clusters, but they've gained a lot of tremendously useful information on how the disease spreads. So, for example, in those cluster investigations, they've determined that only 1 in 5 people actually spread the infection further. 80% of people don't spread the infection further in these cluster investigations, which means there's a particular subgroup of individuals who are potentially, for different reasons, the infection can spread more easily. And they've really gone down to the environments in which this transmission has occurred. And very often these environments were group environments where they've seen these clusters occur. And they've been very much on top of that for a number of months. What they've seen in 3 areas, 3 hotspots, which is a number of prefectures, and I won't even begin to try to pronounce them, but Tokyo is one. And they've seen a number of cases in the last couple of weeks that cannot be linked to chains of transmission. And that's not good. But what is good, they're looking and they're trying to find. And what they're seeing is they have a number of cases who they can't link to those chains. And that's why they've been taking more community-based actions to try and push infection down, and they'll continue to try and do that. But we're not seeing that phenomenon all over the country. They very much have identified where they're seeing that unlinked transmission, and they're working extremely hard to try and suppress that. So they're taking a very measured approach. It's not easy, and community and society in Japan will have to trust that the government is on top of things. But certainly what we've seen and the data I've seen as late as this morning reassures me that they are very aggressively following this, and they may have to scale up measures in some prefectures in order to push down infection. But they will continue with a very, very systematic approach to case finding, isolation, quarantine. And we're very pleased with that, and I believe also will up the rate of testing that they're doing for suspect cases, and we support that as well. Thank you.
Thank you very much. Next question, the new humanitarian Ben Parker. Ben, can you hear us?
Yes, thank you. My question is about the infodemic. We're seeing a lot of rumors and conspiracy theories around the Bill and Melinda Gates Foundation, vaccines, and a digital identity project called ID 2020. My question is, are you tracking the new ingredients in the